Yes. So, the history of functional planes dates back to Kingsley, Norman Kingsley era, which was late 19th century. Moving to 19th century, the orthodontics was primarily focused on movement of individual teeth rather than um, treating the entire dentition as whole. However, in late 19th century, two visionary individuals revolutionized these concepts. Yeah, it was Emerson Angel who advocated widening maxillary arch by opening the midline suture. To achieve this, he introduced use of vulcanite plates. It dated back almost like 1860. Previously, it was believed that crowded conditions in the front teeth might be caused by narrowing or contraction of the dental arches in the premolar and molar regions. So they either tried to widen these regions or extracted teeth in these regions. And after Emerson Angel, it was Norman Kingsley. This person introduced an alternative way of using vulcanite plates in the treatment that doesn't involve extracting premolars. Uh, he is our Norman W. Kingsley, the orthodontia's greatest genius, as entitled by E. H. Angle, who himself is father of modern orthodontics. Yes. For treating class 2 division 1 cases, which is basically increased overjet condition. Okay. For that, he tried to reduce this overjet by making the lower jaw positioned forward. He made the patient to voluntarily move their lower jaw forward. He termed it as previously said, he termed it as jumping the bite. Okay. To reduce the upper teeth prominence, he employed using occipital anchorage. The mandible was made to retain in this forward position until a firm relationship was established. So this is the modified version of bite plane which Kingsley used. Yeah. So let's look into the bite plane and inclined plane concepts. The inclined plane and bite plane were the precursors for the whole evolution of orthodontic appliances, as evident by the documentation of Dr. Weinberger. He is entitled with the term the orthodontia's historian. Yeah. The prominent personalities who promoted the evolution of bite planes and inclined planes are as follows. Dr. John Hunter, who is an Englishman, he gave the first clear statement on orthopedic principles and growth of jaws. He used bite plane over the molar teeth. And later, Joseph Fox, a student of Hunter, who is also another Englishman, he was also the first to observe the mandible grows mainly by distal extension beyond the molar with little or no increase in the anterior region. He used ivory bite blocks to open the bite. And later, Catalan in the year 1808 used inclined planes. Robertson W.M. in the year 1835 used inclined plane as a part of expansion arch. Rodriguez in the year 1839 used individual inclined plane, and Mortimer in 1845 also used an inclined plane, which is documented. First very person to introduce a proper bite plane into the dentistry was Dr. Ware. His bite plane is made out of gold and used to open the bite in the closed bite conditions, like deep bite conditions. So let's look into the Kingsley's bite jumping appliance. Vulcanization of natural rubber with the sulfur has been discovered by Charles Goodyear about the year 1839. Since then, a great progress has been made, especially in the field of dentistry with the use of vulcanite material, because vulcanite plates were more affordable than precious metal like gold, which were used earlier. E.A. Tucker of Boston of USA was the first to use vulcanite in the orthodontic appliances, and first in America. He is also famous for the use of rubber bands in orthodontic appliances, which was around 1846. Later, Baker and many other people modified these rubber bands to provide intermaxillary forces. Norman Kingsley, who initially extracted premolars to gain space for anterior teeth to move back, gave it up later after trying the jumping the bite by vulcanite bite planes in 1879, thus becoming the first person to advocate forward positioning of mandible for correction of mandibular retrusion. Kingsley thought that when arches were placed and held in a good relationship, condyles would grow and accustomize to the existing new position. So this is the Kingsley's modified appliance. So we can see here that patients were made to bite forward and the surface A holds the lower incisor in position. The appliance engraves some elastic ligatures connected to the hook in the roof of palate and were drawn out through the corresponding openings connecting with a gold bar which was worn across the buccal aspect of upper incisors. The gold bar retracts the proclined upper incisors. Okay. Objectives of Kingsley's inclined plane appliance was to change or jump the bite in case of excessive retruded mandible and not just to protrude the lower incisors.